me why are you here? What's going on?
I mean, mainly this kind of like upper left quadrant neck situation.
Okay.
It's just been kind of this ongoing. I don't know if there was like I don't think there was a specific injury
Hmm.
situation that
Hmm.
happened. I don't. It's been at least 5, 6, maybe 7 years that it's
Okay.
been a situation. I went to massage school, over 5 years ago, and it was a thing before that, and I
Okay.
was like excited
Right.
to go to massage school and talk to teachers about it. And I was like, I'm gonna get this figured out.
Right.
Nice,
Right.
and didn't have a lot of receiving massage experience prior to that either. So it's like this is a muscular thing, and
Right.
and then went and got all the massages for over a year and stuff, and it just like never really like got better. It like temporarily relieves it, like massage feels good,
Sure.
it's good for the muscles and stuff and
Right.
relaxing.
Yeah.
So yeah, there's relief, but it's still just this like thing. I like notice that my head's just kind of like I'll catch myself. I'll like tune in sometimes to like my posture, and I'll notice
Sure.
that my head's like tilted this way
Uh-huh.
often, and it just feels like there's something there. If I like try to do like a neck roll, it's like fully extended, fully extended, fully extended, and then I feel like a bump or like a hump that it has to like go over, and
There's a
it
bump.
gets like crunchy, and it's just
Okay.
like
Okay.
so.
And you're 34 now?
Mhm,
Okay. And your general health is good.
mhm.
Okay. Is the pain only there or does the pain radiate or travel anywhere?
It kind of travels down the arm a little bit when it gets like when it's really bugging me. It
Hmm.
kind of flare when it has like flare ups, kind
Okay.
of
Back of the arm,
back of the arm.
past the elbow,
No.
just upper arm,
Hmm.
and nothing, no pain or tingling in the hand.
No.
Okay. Are you
Yeah.
left-handed or right-handed?
Right-handed.
You're right-handed. Okay. Do you notice any, like, obviously most right-handers are going to have more dexterity with their right hand.
Hmm.
Do you notice any issues with the particular issues with the left hand dexterity?
No.
Okay.
I will say that I have felt like tingling in the left hand a couple times.
Okay.
Not necessarily like connected to a flare up or anything, but I have just noticed sometimes that it's just like, hmm,
Okay.
you know.
Got it. Um, okay. And do you have any memory of like a neck injury, a whiplash, a head injury, anything like that?
To be honest, I try to like pinpoint it to something, and there
Yeah.
was like one time at a bar like years ago,
Uh-huh.
and my girlfriend like playfully pushed me,
Uh-huh.
and I kind of like fell back and like hit the booth in a
Uh-huh.
weird way or
Uh-huh.
whatever, and I kind of like it's like the only thing that I
Okay.
can kind of like
Okay.
maybe that was it years ago, but
No
who
whiplash, no
knows?
rear end car accident, nothing
No,
like
nothing
that.
crazy like
Okay.
that.
And what is, if you don't mind me asking, what is your job? What do you do day to
Um,
day?
right now I'm serving tables. I just
Okay.
spent the last 7 years prior to this doing like working in a smoothie shop,
Okay.
and
So you're
so
on your feet,
on my feet for that, and
carrying,
then
moving around all day.
and then oftentimes have a second job where the last couple years my second job has been selling merch at
Okay.
shows. So there's like days where I'll go to work in the morning doing stuff at the smoothie shop, a lot
Right.
of repetitive like
Mm-hmm.
blender stuff going on,
Yes.
and then on my feet all night until 2 in the morning, 3 in the morning,
Wow.
selling merch,
Right.
and yeah,
A lot
so
of hard work, fun,
yeah, yeah,
but working hard with
yeah,
physical.
yeah.
Okay.
We're
On your feet.
dancing at shows a lot. I go to a lot of concerts pretty much like every weekend. I end up
Okay.
at some sort of show
Okay.
dancing and stuff,
Lots of
and
movement.
yeah, so
Good. Keeps you in shape.
yeah,
It's good for the spirit.
yeah.
Awesome.
We're using our body for
I love
sure.
it. So we're ready to start with some basic exam,
All right.
and I'm going to touch you now. So I'm just going to kind of get a sense of your anatomy, which generally is the same from person to person, but we want to make sure because there is a lot of variation. And so I'm feeling for swollen lymph nodes and abnormal pulses or any sense that anatomically something might be unusual and something we would need to know about or might be an indication for an x-ray. But so far everything feels good, right? These clavicular lymph nodes are totally non-palpable, which is normal. Cervical lymph nodes also not palpable. So that's good. I'm going to feel your pulse, okay?
Okay.
Just the carotid pulse right there. Nice and strong. Nice regular pulse. A little more than 1 per second, which is what we want, normal, somewhere in the 70 to 80 range. Okay, I'm going to put some pressure now through the top of your head,
Mhm.
and I want to know if this hurts your neck, okay? So we're going to go slow and gentle Nothing sudden. Is there any pain in the neck when I do that?
No.
Is there any pain coming down the back of that left arm when I do that?
No.
Okay. So we're going to take it a little step further and get a little more compression on the left side, which is the affected side. So as you can see, I have my left hand cradling his left neck so that I can feel for any like spasming that might take place or guarding. Is that sending any pain down the left arm?
No.
Pain in the neck?
Mm-mm.
Feels fine. And just for completeness, let's do the right side. Good. So I'm going to listen to the arteries in your neck. Normal arterial blood flow is silent, and that all I would be able to hear through the arteries is the heart sound. If there's any turbulence in the flow of blood through the artery, that means there's like a clot in there or something is obstructing the flow, and it makes a sound like a like that. So that's what I'm listening for, because if there's any clotting in there, which is like a 99.9% chance that there's not,
Right.
I don't want to dislodge it, right? So we're just going to give a listen. Yours are clear. Wonderful. I have occasionally heard, maybe 3 or 4 times in my career, abnormal blood flow. Yeah, which then that needs to be checked out. And it's always been fine, but it's like better safe than sorry. Yeah. Good. Good. Textbook, healthy. 120/70. Okay, we got a green light to do some body work. Cool?
Nice.
Nice. Yeah. I'm going to work through the layers of muscle a little at a time and see what I can feel. A lot of these neck issues stem from the shoulder. And if there's any sense of like rolling forward or protraction of this left shoulder, that's going to be pulling on the lower left neck, and we're going to want to address that as well. So that's where I'm starting.
Cool.
So you can see this arm really has nice responsiveness. As I go to depress that clavicle, it goes down, springs right back. It's really smooth. And I'm feeling with my right hand on the left side of your neck how the neck muscles are responding to this. And they're not really super happy. So there's this knot on your left side that starts way down here. I'm around the level of T3 with my middle finger, kind of like this. And as I'm moving your scapula, your clavicle, and your shoulder into depression, I want to feel like this rhomboid and these upper thoracics are happy to go along with that movement. And they're not really, they're kind of stuck. So I'm feeling that stuckness now with my left hand coming to the left side of the spine. And right here, that's the first thoracic, 7th cervical, 6th cervical. So you went to massage school. You're somewhat familiar with the anatomy.
A little bit.
You remember?
It's been a little while.
Been a while.
It's been a while. I didn't do much with it afterwards.
Okay. So there's 7 cervical vertebrae. C7 being the lowest one on you. That's right there. And then the thoracic spine starts right there. And yeah, so I feel what you're feeling in the lower left neck and upper left thoracic spine and left shoulder is that some muscular issues. The upper trap is here. It's a little tight. The levator scapula is here. It's quite tight. The scalenes are here. They're quite tight. Coming up to the other end where those muscles attach to the upper cervical spine, it's also pretty tight and pulling. Yeah, so I wonder about your tendency to tilt your head to the right. It's like your body's just instinctively trying to get a little bit of a stretch on those tight muscles. So let's see what we can feel about these vertebrae. And how's my pressure so far, by the way?
It's feeling good.
Good. All right. If you need me to lighten up, please let me know. I like to be pretty direct, but I don't want to be too pokey.
Yeah, no,
Yeah,
this is comfortable.
good. So we're going to start here at the very top, and there won't be any sudden movements, okay?
Okay.
You're not going to be adjusted without knowing that it's coming. So I've got his occiput here under my left middle finger and C1 under my right middle finger, and I'm feeling for the ability of these to separate. And I'm feeling for the ability of that left occipital condyle to glide forward on the atlas. So I'm kind of holding his atlas, not totally still, but stabilizing it while I pull on the occiput. And that's pretty good movement. Looking at C1 on C2, that's mostly rotation. So I've got my pointer finger here on the transverse process of C1, and now my middle finger on C2. And I want to feel separate rotation between those two. And I don't, right? These two are stuck together. So they're rotating as a unit. And that's really going to inhibit the ability of his neck to rotate to the right. When we go to C2 through C7, we're mostly concerned with side bending ability, because that is the movement that really requires the most freedom of movement of the discs and the facet joints. So I'm coming through one by one and just segmentally giving some side bending. So here's around C5, and we're getting good movement. And I come down here to C6 on C7, and it starts to get a little sticky. And here I am on C7 on T1, and that is where it is stuck. Is this where you feel it?
Yeah.
Is that the spot? Okay. So where I feel it stuck is where he feels it stuck, and that makes me feel good as a clinician that I have located, yeah, right there. So the deep muscles hugging C7 and T1, and the vertebrae of C7 on T1, that's the center of the problem. So as best as I can tell here from my myofascial evaluation, the shoulder is not terrifically restricted or stagnant. There's a little tension through the pec muscle, a little bit here in the subclavius that I definitely want to work through. But unlike a lot of times you find these lower neck issues really are coming from the shoulder, I don't feel like that is the case here today, that this is an old neck injury. So it may be like overuse from dancing.
Yeah.
Also, you didn't mention this before, but I saw it on your intake that you used to have lots of dreads
Yeah.
and this really heavy hair.
Down past the waist.
Okay.
I had that growing for like 10 years and cut them last year.
How did that go?
In cutting
I mean, I'm
it?
so curious.
Yeah, it was a journey for sure.
Uh-huh.
I think when I initially started growing the hair out, I was just like, I'm not cutting it for 10 years.
Yes.
Just trying to make like the 10-year milestone.
And you did it.
Right around 9 years, I was pretty over it. And that last year, I was like really wanting them off my head.
Huh.
Sometimes you have it back in like a bun thing, and it's just like this ball like right in the back, and yeah, like, I don't know, like the body mechanics are not good for sure.
I love that. So we're gonna come through the right side as well, because the neck is a cylinder, and ideas about left and right are purely abstract and notional, and of course relative. So the disc, there's only one disc, and it's in the midline. So there's two facets, one left, one right, and you can have a left facet restricted and the right facet functioning well. But if the disc is dysfunctional, it's obviously affecting 360 degrees through the neck.
Mm.
So we want to make sure that we're covering all these bases. So here we are again, occiput on C1, and that feels pretty good. C1 on C2, rotating to the left. So that is what good movement feels like and looks like, where there's nice separation of C1 and C2 transverse processes as you rotate to the opposite side. So I'm really exaggerating the movement here. So on his right side, it feels like this, and on his left side, it feels like this. They're stuck together. So now coming down through the side bend, segment by segment. This is pretty much the speed and pace at which I would do this exam, whether someone was watching, whether we were taking a video or not. It really only takes about 2 minutes, 3 minutes to do. Whole neck, clavicle, just kind of a survey. So these upper arms, quite muscular. This is the upper body of someone who carries things a lot. So from your story, Michael, what I'm gathering is that when people just work the muscles, it doesn't really solve the problem for you.
Right.
And so,
Like this feels really good right now and it
yeah,
feels better,
yeah,
but I will still feel it
right.
in a couple days or tomorrow or later on or something.
So this has been going on a long time.
Hmm.
So I would expect that because your body is compensated to it and adapted to it and sort of used to it, that one or two adjustments probably would not fix it
Right.
forever,
Right.
but it would be very instructive to know if it did give you relief and for how long.
Totally.
And I think it's safe to do it, so I think we should go ahead and give that a try. Are you up for that?
Absolutely.
All right. So we're going to start with the upper right here, okay?
Okay.
So the idea is we need to free up C1 from C2. And so I kind of want to get a sense of what position is C1 stuck on C2. My motion palpation told me that it is stuck, but I got to do some static palpation to kind of tell me exactly in what way. So I'm feeling his mastoid processes right here with my thumbs and getting a sense of their relative position to the upper cervical spine, okay? So what I can feel is that his left mastoid is a little bit left and a little bit high and a little bit back. Okay, so that's following the atlas. So the atlas position is going to be left high and back sort of like that. So our idea to adjust it would be a little bit down, a little bit forward, and a little bit to the right in that plane. It's three-dimensional, and the atlas is a ring. So we have to think about its position in 3 dimensions. And it shouldn't take a ton of force to do this, but it is going to take a bit of a push. And there might be a noise, okay?
Cool.
So the C1 transverse is here. I'm going to get my thumb on it. And again, we're going to come down. We're going to rotate toward me. And we're going to go left to right, kind of like for the door stopper. Okay, so take a deep breath and you're going to feel my left hand give a little nudge. Okay, good. Out through the mouth. Good. Just a little bit. Pretty easy.
Nice.
Yeah. So let's bring him back to neutral. Give all those tissues a little stretch. Take them through their range of motion and kind of give the body a sense of how much movement now is available. Because remember, we're adjusting bones and muscles, but in the end, what we're working with is a nervous system. And nervous systems are about information. A lot of that information is information about position and movement. That's a lot of what's coming through. So giving these a little massage and feeling again the movement of C1 on C2, and it's freer. So we accomplished that. That was good.
Nice.
Let's go down here to C6 and 7. So again, oh man, I'm just going to move that one camera. There you go. Okay, so like before, we did a motion palpation before. We're doing this side bending and really feeling the asymmetry of freedom of movement, the right side bend and left side bend when it comes right here to C6. So we're going to want to induce some left side bend of C6, but we don't want to just adjust into side bending because that's going to squash the disc. And this is a three-dimensional structure that moves in 3 dimensions. So there's a side bend and a rotate and a posterior to anterior movement. So can you lift your chin a little bit, Mike? Good. And let it rest right there. So there's going to be a little bit of extension. It's going to be a little bit of left side bending and a little bit of left rotation all at the same time. And it's both of my hands that are going to be accomplishing this. Okay?
Okay.
Good. So again, a nice deep breath. The nose comes toward me. And nice. You're going to relax that right hand down. Breathing out. Let it out. It's going to take a little bit more. There it goes.
Nice.
So we had one pretty deep release. That's what I'm looking for. Sometimes it's a whole string of vertebrae that release all at the same time.
Right.
But it's nice when it can be precise in just one. Let's go palm up with this right hand so we can. So here on the left side now, looking at him from the posterior, really good symmetry, lots of great muscle development. And you can see the redness here where I was working. And otherwise, there's no swelling, nothing unusual. Medial border of the scapula here, very smooth. A little bit right there, you might be able to see a tiny little twitch of his rhomboid where there's a little attachment trigger point. Let's work that out a little bit and get closer. Yeah, I don't know if you can see the twitch, but I can feel it. You feel that little speed bump right there?
Yeah.
Yep. Okay. So as C7 and T1, the longer they've been stuck together, the more all this upper trap, all this rhomboid stuff is going to have to compensate, get tight, congested. So we know that's been worked. I know you stretch. I know that you get massage. So still want to do that. Some of this superficial fascia as well. Here's the lower trapezius right there. A little bit tight. But let's really key in as well to these ribs. How do we feel? How do we assess and work with the junction of the rib and the spine? So the rib cage, Mike comes up like this. This, say 12th rib is here, first rib is here. So all this is rib cage, and the ribs like my fingers coming up and then diving deep right here. And you can feel it. There's a gutter where the rib angles in and the transverse process of the vertebra comes up to meet it. And that should feel smooth. Should be a nice smooth gutter all the way up. And every once in a while you feel on someone something like right there. It's just not as smooth. And that's it right there. So what rib is this? Let's see if I can count. So here's 1, 2, 3, 4, 5, fifth rib. And on the right side, going up the gutter with my thumb, my finger, pretty smooth. A little bit stuck here, and that would be his third rib. So let's do this. Let's take this fifth rib and let's get into it right there. So I want you to take some deep breaths and let it out. The main function of the rib mechanically is to elevate when you breathe in and gently, slowly descend as you breathe out. That's the movement I'm primarily concerned with here. If we can get that movement going, a lot of other things will fall into place. So as he's breathing in, I'm not getting enough elevation on this fifth rib. So we're going to induce that, okay? As he keeps taking these nice deep thoracic breaths, on every in-breath, I'm pulling on the fascia and I'm getting some elevation of that rib. It's gentle, it's not forceful. There's no need to put a lot of force into these ribs. And always better to use the least amount of force necessary, because that's the safest for the patient as well as for the provider. Chiropractors wear out their wrists and hands and shoulders and lower backs. Sometimes that's a function of their genetics and the body they brought to the table, and sometimes it's a function of how they use it, which force they're putting into it. Okay, coming to this right third rib right here, a couple of deep breaths here. Beautiful. Yeah. So we have a little bit of the opposite happening here. This third rib elevates pretty nicely with an in-breath, but I'm not getting the depression that I want. So it's gentle. It doesn't take much. The amount of movement at these rib spine junctions is just a few degrees. There you go. Creating a little space for the scapula. So this will free up movement of his whole shoulder girdle as well. And this is just a first session, just kind of getting things started. With a condition like this, you know, I would think we would be able to make a pretty significant dent in 3 or 4 sessions, and then probably wanting to have maintenance visits to stay on top of it, because he is active and you are going to accumulate little injuries and biomechanical issues, maybe like every 3 months, every 4 months kind of thing for proactive maintenance care. That's pretty much how I would approach this. Good. So I really like how this left side is feeling right now. I like the smoothness here at C7. So at C6, there's still a little bit of stickiness, but I know we got a good adjustment on it, so I'm going to leave it alone. That could just be residual deep swelling. And what I want to look at now is a little bit of this bunchiness on the right side. I don't want to ignore that because that's going to be restricting the movement of his thoracic spine as a whole. And I can feel it. It's this whole erector spinae between about L1 and T8. So we're going to start on the superficial fascia, and it's just a gentle stretch, just like this, kind of pinning it down here around T4, 5, and then holding it here at T11 and lengthening. Kind of thinking of it like pizza dough, just working it gently. The way fascia will respond to you is if you move it too quickly, it's going to tighten up. You have to work it at its own pace, which is dependent on its physical properties, the collagenous fibers, the elastic fibers, the watery suspension of the ground substance, but is also related, again, to the patient's nervous system, because the tone of this fascia is directly under neurological control. In these postural muscles, that would be the postural centers, which is mostly subconscious. And so if you go in really quickly and you try to go too deep too fast, that's going to elevate that autonomic tone and it's going to tighten these tissues. And you're not going to get the result that you want, which is softening, relaxation, which allows for lengthening, allows for things to kind of settle in to a nice, easy, comfortable position. At the same time, not only are we not stimulating some fight or flight autonomic response, we're also really trying to generate parasympathetic activity, which is going to open circulation to these tissues, which is going to be relaxing. Because we're treating bodies, muscles, and joints, but again, at the heart of this all, there's a nervous system that made the decision to come in here and lay on the table. And it's a nervous system that's going to be walking out. And we want soothing. We want the body to be a refuge as much as possible. And I want this space to be a refuge for people as well. So they know on the conscious level as well as on that autonomic subconscious level that the touch is safe and is going to be respectful of their body and their nervous system and their needs. So that's how I approach it and why. And take a couple of deep breaths here, Mike. Okay, good. I like what I'm feeling. Soft, gentle, nice, easy breath. Breathing out. So that's your session today. And thank you for coming in. I really appreciate it.